Good morning and welcome to beautiful downtown Delray, where this morning we find ourselves at the Rosewater rooftop bar at Delray at the Ray Hotel. It's so exciting to be here this morning. We have our guest CEO of Eat Better, Live Better, Debra Tendrich, with us here today. And we're really going to be talking about scarcity in food and how it is that we are helping within the foundation to be able to go in and fill that need. We had such a great conversation the other day, Debra. It's so wonderful to have you here in front of the camera and to be able to really understand more about your foundation. What is Eat Better, Live Better all about?
Well, Eat Better, Live Better is on a mission to prevent, reverse, and reduce childhood obesity and other dietary-related illnesses. And we do that by providing nutrition education and healthy foods to the community.
I think that the community would like to know, how do we eat better and create solutions for low-income housing residents?
Well, you first have to identify the problems and the hurdles and the barriers that certain communities face when it comes to eating healthy. Not every neighborhood has a grocery store available within walking distance, especially in communities where not everyone has transportation.
Yeah.
Especially if you look at seniors who are homebound or individuals who can't afford right now, especially with inflation, afford insurance for their cars or gas for their cars. So more and more people are needing to eat at corner stores and at gas stations for food instead of being able to drive themselves to the grocery store and afford these skyrocketing prices.
Yeah, inflation is going up, and just coming out of COVID, there's many challenges that you must see within your community facing and in regards to getting produce and resources. You know, where do your fresh produce items get delivered, and who helps you to pack over that 1 million pounds of fresh produce a year?
Well, we provide more than just fresh produce. We also provide staples, healthy staples for the families. We're providing more nutrient-dense food that families can cook and actually have real substance and nutrient-dense foods that they can eat on a daily basis.
Yes.
We have an amazing team of volunteers that make this possible. We actually, since the inception of our grocery assistance program in March of 2020, right when the pandemic began, I knew there was going to be a food crisis.
Yes.
So this grocery assistance program has been paramount in basically feeding people who would have skipped meals, who would have rationed their food or not eaten for a few days. We've fed seniors who are eating cat food because they couldn't afford real food or have access to real food. So our organization, through our volunteers, our donors, our supporters, the families even that we serve, we couldn't do it without the need. And right now, those in need shouldn't just take anything that's available to them. They should be fed with dignity. We provide them with quality food, and we don't make anyone feel like they're getting a handout, just a hand up.
A hand up. What a fantastic way of looking at things. I absolutely love that, because that really is what dignity is about. And your integrity is so strong. Truly, it's really the basis of your foundation. You know, when we were speaking, I was asking you then, who do you partner with? You have so many different programs that you have going on inside of Eat Better, Live Better. So why don't you just tell us all a little bit about who and what foundations you do partner with?
Well, the partnership is interesting because it's not just partnerships for money or food donations. It's also partnerships in helping identifying which families are truly in need and who are food insecure.
Yes.
So partnering with faith-based organizations, the community policing teams in the community, working with other nonprofit organizations or clinics that are sliding scale clinics to low-income clinics that can identify these families, senior resource centers, aftercare programs, and teachers. They're all part of the partnership process because they can help identify those who are truly in need.
Yeah, that's really incredible that you're able to go into your community and use the resources that you have that will bring you families, right? And let them know about you, and that you really are boots on the ground, and that you're able to just fill that need immediately.
And it's interesting because we really go out of our way to focus on partnering with those who provide medical assistance, because we're probably Well, I like to say that we're revolutionizing the way that nonprofits feed the community, because we're not giving things that are high in sodium, high in sugar, things that are saturated in syrups and
Right.
high fructose corn syrup. So
What did you say? Boxed and
avoid boxes and bags.
avoid boxes and bags. That's a good tip for all of us.
Yes, if you have boxes or bags, they're usually processed. They have ingredients that are not necessary and sometimes even banned in other countries.
Yes.
But we still use them here. So it's kind of like eat at your own risk kind of thing.
Yes.
That's why fruits and vegetables don't have nutrition labels, but all those things from boxes and bags do, because they're like warning labels, like stop, read this.
Right. What else is in there?
Exactly.
Besides the food, the fillers, right? Well, there's two main groups of families that you really feed. Can you tell me about each one of them and how you handle those needs?
Absolutely. So there's two of the largest groups of families that we serve are the seniors who are on fixed incomes, and they can't keep up with the rising cost of life, but their income will never change. The other side are the families that are working, and they're in the same situation. They can't afford the rising cost of rent, the rising cost of food, gas, but they're still working, and they're choosing between like paying their light bill or buying food. They're having their kids skip meals or ration meals, or the parents are skipping meals just so their kids can eat. And those are the two biggest groups of families that we're serving, and we don't see it getting better. In fact, our numbers keep growing. We keep hearing more stories like this. Those who made it through the pandemic can't make it through these rising prices.
We were talking about generational wealth and how it plays a role in the socioeconomic background of those families. Can you speak to that generational wealth?
So if you were put into a situation where you were in a destitute situation, do you have a family member or a friend that you can call that might be able to help you with a place to stay or food or a bill?
Generally, it would be the people that you are, those 7 people they say, right in your inner circle. That's really what makes who you are. So if everyone around you is in the same socioeconomic background, how do you move forward?
Exactly. You probably have someone, if you were ever in that situation, you could pick up the phone and say, I really need your help.
Yeah.
Help me get back on my feet. Well, if everyone in your area, your family, your friends hasn't accumulated generational wealth or had the opportunity to, and everyone is in the same position as you, there's no one to help you get out of that situation. You can't ask someone to help you with housing, with a bill, with anything, because everyone in your area is struggling.
Is in the same boat.
And so a lot of our families are in that situation where they don't have anyone they can fall back on or call if they're in that position. And so they call us. And we're there for them just like their family would be if they were in that position to help them.
There's so much that comes out of this issue, especially when you think about children who are going through scarcity as well as their parents. Let's speak just for a moment. Healthy Family Palm Beach really supports lifestyles as well as different modes that we can all work together, information that we put out there through our periodical to be able to give information. And mental health plays such a big part in all of this. Speak to me a little bit about what you see when you are delivering this food to these families' doors. What in the mental health realm can you speak of when it comes to the parents and then the impact on the children?
Well, children, they're going to school every day, sometimes on empty stomachs.
Yes.
They can't concentrate well. They are usually doing worse in school than the other kids. They can't focus. They have elevated mental health problems because they're insecure, they're bullied, they're not able to, since they're not doing as well in school, they tend to, draw back from socialization. They miss school a lot more often. And the parents, they have a really, really hard time dealing with the fact that they're not able to provide for their children. Even if they're working, the money that's coming in from their job isn't covering enough to pay for food or,
Really creating a lot of shame.
It is. It's a shameful experience on both.
Yes.
It's a burden that children shouldn't have to bear.
Yes.
That waking up in the morning to go to school on a hungry belly and try to hide it from their friends, that's a big, big secret that a lot of them don't want to share with anyone. And, these kids are just really carrying a lot of weight on their shoulders. And their parents, they feel guilt, they feel shame. And when you have to come to an organization and ask for help, it also does something to your ego. It could be embarrassing. It could be
humbling, not to say the least, right? To be able to have to take you and your children there to be able to provide for them. I know that your foundation really allows some of the families to come in and volunteer on their own time. They're not paid in food. They're paid in the feeling of being able to help within their own community because they're being helped. Nobody's looking for a handout.
Right. A lot of our families, they ask if they can volunteer because they don't want to just receive help. They want to give back as well. And it makes the receiving process easier to deal with, especially when you're dealing with a huge group of families that never needed to ask for help before. This situation is completely uncharted territory for so many of the families that we served. Families go ups and downs, and we're here to help them get back up when they're in their lows, but so many of our families have always been up, and this is their first time being down.
We have systems that are in place. Do you think that they're working?
I think that for a lot of people, they're hard to manage and to maneuver through to get the actual adequate support. And on top of that, the system is kind of built in a way where you could be working, and if you take that promotion and make that extra $100, you lose everything. Yes. So it's demotivating.
It is demotivating.
To have someone get offered a promotion but not be able to take it because they'll lose their insurance, their housing vouchers, their child care, just because they're making $2 an hour more and have an opportunity to elevate their careers.
It's really interesting because it really is on a national scale. And as you and I both know, there is no one set law. It seems as though the states have their own ways of moving through this issue. What would you like to see happen to help create solutions in the system as it sits today?
Well, there definitely has to be a transition period where just because you take that promotion, everything isn't cut off.
Right.
That will give families and individuals an opportunity to transition out of poverty, out of needing assistance. Because if I were to, say, go from having a job that paid me enough to take care of some of my bills, but not all of them, and I was getting additional resources to help, and I went and decided I'm going to take this promotion, but then it leaves me homeless without and uninsured, what do you think you're going to do?
You're going to protect your family and stay where you're at.
Exactly, and continue to struggle and rely on assistance for the rest of your life. If there was a transition out of poverty, opportunity for these families where, we would actually help continue benefits and get the family to a point where they don't need any assistance. It's very, I think, it will do something for not just that mom and dad who are trying to show their kids, but it's also going to show their kids that you can come from the mud and, dig your way out.
Well, Healthy Family Magazine really loves being able to promote what goes on in our community as well, and you partner with law enforcement. What programs does Eat Better, Live Better partner with here in Delray, and what do you guys work on together?
Well, in the community, especially the Delray Beach Community Policing Team, they're amazing. They are designed to help bridge the community together and build trust between the community and the police department. So we've used our program to help increase that trust. Food brings trust. And when the police officers are coming in their police cars and their uniforms with a bag of food through a partnership through Eat Better, Live Better to their home,
Yes.
and delivering it to these homebound individuals or individuals who don't have transportation to come pick up their groceries, it creates a trusting environment between the police and the community, which you're not just going to be arrested if you see the police.
Right.
Police are also there to do good and help.
Yeah, it really is such a foundation building program working with law enforcement for these children to not only get the reinforcement in school, but that they're standing at their front door, filling a need. It's really incredible. You know, on a daily basis, how many families do you think that your foundation feeds?
Well, it's hard because those numbers are growing. To put in perspective, we served about, I would say, like on Friday, we'll probably serve well over 2,000 individuals on May 6th, you know, the upcoming Friday. And that's just in one day. You know, and we have emergency families continuously through our doors. We have calls of families who need help. We have groups of organizations trying to get us to feed large amounts to their families. And right now, it's two problems that we're facing. One is we have more families to feed, and the cost to feed each family is greater.
Yes.
So trying to overcome that to make sure everyone gets nutrient-dense foods, access to it is one of our primary goals right now to focus on.
Well, it's interesting because you're working with the Palm Beach school system in the summer camps where you have developed Superpower Snacks.
Superpower Snack Pack program.
Yes.
Well, in fact, it's not so much the school district we're working with there. It's more of the aftercare programs and summer camps. Where, you know, the kids that are in the school district, they'll go to after school or in the summer camps. And what's great about that is we're actually working on we're working with about 15 kids right now with the Superpower Snack Pack program. And actually at this one program, 9 out of the 15 kids are homeless. And what that means is that 3 days a week, these kids get this amazing opportunity at this aftercare program at the Quezon United Methodist Church. Eat Better, Live Better provides healthy snacks for the kids all week. The organization Living Hungry, which was founded by Maura Plant, that organization provides food for the kids to take home all weekend. And C-Ron with the KOP mentoring program provides a fun aftercare experience and a safe place, while Quezon United Methodist Church houses everything. So, I mean, if you look at, that's 4 groups coming together to serve, and that's one of the biggest things that I think people don't grasp is the collaboration it takes. And the community involvement and support from not just Eat Better, Live Better. It's more than one avenue of support that these kids, these families need, and we can't do it alone. So collaboration and partnerships, you know, they really take it to the next level on serving the community.
You know, Debra, you said earlier that the foundation, that you serve food with dignity. What does that mean to you?
Well, our families don't feel like they're coming to get a handout, like just come get some food and assembly line feeder. No, our families have built relationships with us. We foster these relationships and develop into, we know their names. They'll come in the waiting room and we'll dance together. You know, it's just more of it feels like you're running an errand than it does coming to a charity for help.
Yes.
And that's the environment that's really, really important to create when you have so many people who the feeling needing help does to people. You want to alleviate that when someone actually has the courage to come and ask for help. You don't want to shame someone or make them feel like they're there because they can't do it themselves.
You know, it's so relatable. I think we've all fallen on hard times where we've needed to ask a friend, a coworker for help, to help alleviate some situation where here you are, really making sure that these children, some of them homeless, have a meal.
And not just that. When I was growing up, my mom was a single mom teacher, and we had to eat at food pantries sometimes. And that's a single mom with 2 kids who's a teacher.
Yes.
And everyone needs help at some point.
That's right.
And I know that she never felt great with the quality of the food she was getting us from the pantry, and the feeling it gave her when she had to walk in and make a bag of food to take
Well,
with
what
her.
are the standards and how are they met? Is there a standard for what your service can and should provide?
Yeah, I believe that you shouldn't give anything you're not willing to eat yourself.
Yeah.
And when you have a huge amount of families that are relying on you for substance, for a basic need, and most of our families don't have access to it in their own neighborhoods or the ability to afford fresh produce or any of that.
Even grocery scarcity. We were talking about how neighborhoods at times are set up and there is not within walking distance a grocery store.
Right.
So the offers they are given are corner store food.
Right, and that's why, we feel our standard is to make sure that the quality of our food is way up here. The standards are so high, because if not, then who will be providing, how will these families have access to these groceries? And not just that, Eat Better, Live Better is more than just food. We're an opportunity to eat better and live better.
It really is incredible, because doesn't it start with what you eat as to how you live?
It is. And if you price cancer, if you priced the amount of time people spend at the doctor's office, if you look at the quality of life that most seniors are facing right now, requiring 4 to 5 pills a day just to stay alive and 3 or 4 doctor's visits a week to stay out of pain, if we have the opportunity to intercept that and change the direction of the health of these families now so they don't have to experience that long term, that's our reward. That's an opportunity for us to not just feed people, but
to build community.
Healthy community.
And while you're building a healthy community.
And healthy families in
That's
Palm Beach.
Right, in Palm Beach. It's funny because your foundation really held an amazing 5K run for years, and this year you had to cancel. Can you speak to that?
Yes, actually. The 5K, we get hundreds of people to come out and support that. It's fun, it's lively, it's a great healthy activity for the family. And this year we had so many people needing food that if we shifted even a little bit of our focus away from feeding, we would not have met the need. So we actually had to postpone and cancel this year's 5K. I'm getting emails and calls about it right now. I'm trying to register and I can't. So we're going to be planning this for next year.
Great.
And bring it back. But this year, just with the surge of families and the situation we're in, we couldn't shift focus for a minute.
You guys have been busy. You do a teacher's giving.
Mm-hmm.
I wanted to talk a little bit about how you go right into the school systems here in Palm Beach County.
Yeah.
And you really create this feeling of healthy living by being able to give back directly to the workers who give so much of their time and money. You and I spoke candidly about even the pay of teachers and a lot of them having to dip into their own funds to supply for their classrooms. We all know this is true. I feel teachers are underpaid as well. And I'd like to hear a little bit more about that Thanksgiving type program that you created.
It's not just the teachers that need the support. It's the teachers, it's the folks who keep the schools clean. It's the ones who cook for the kids in the cafeteria every day, and they make even less than the teachers.
That's right.
So we do something called Teachers Giving, where we surprise the teachers and support staff with turkeys. Thousands of pounds of turkeys.
Donated to your foundation.
We
in
actually
partnership.
Well, sort of. We buy most of the turkeys.
Yep.
We would love to have them donated, but we buy them through community partners who actually give us funds and support this event in allowing us to purchase these turkeys for the teachers and support staff. So we actually go into the schools, we coordinate with the principals in advance, and we find out how many staff they have. We get the turkeys, we show up, and the teachers are in their classrooms teaching, and then we just bust in the door with the turkey and 5 or 10 people with us, and we make the kids clap for the teachers and everything. We go into the cafeteria, round up all the cafeteria workers and give turkeys to all the staff. It's just such a feel-good moment it does a few things. It takes the financial thing off of the plate of the staff at the schools. We've had teachers cry because they didn't have enough money to buy their own turkeys. We've had teachers say that they had to give their last to one of their students, and we have teachers who even have second jobs just to be able to afford things for their kids that are struggling in these schools. So for us to be able to do this, especially with the rising costs, and not to mention, we feed teachers too. Teachers are paycheck to paycheck already, and then these rising cost of food and life has brought them to seek our services for actual food. So this is a way to help the teachers in a small financial investment in each teacher while doubling up with appreciation, which they do get a lack of.
That is so true. You and your foundation purchased a Biophotonic Scanner.
We did. You did a good job.
What is a Biophotonic Scanner?
Well, the Biophotonic Scanner actually scans your hands and tells you how many antioxidants are built up in your body on a cellular level, which is important because the more antioxidants you have, the less inflammation you have, the less free radicals you have in your body. You're able to get rid of oxidative stress, which also causes aging. And the inflammation in your body is also lessened when you have more antioxidants. So going into corporations, creating healthier employees, a lot of these employees are also parents, so they pass these skills down to their children and their families as well. But what I think is important is that this creates additional opportunities for us to build partnerships and support in the community too. We come in, we get a donation for doing these scans and encouraging a healthier lifestyle and educating the staff, and we get to now take those funds and buy food and support our program to help feed more that are in need.
So it's really an in-house program that you're using to be able to just better and grow. Correct. Eat better, live better.
Correct. And create healthier families outside of just those who actually need it. Because if you ask someone who makes $600,000 a year versus someone who makes $16,000 a year how to read a nutritional label, the answer is usually similar. I don't know. And so this actually gives us the opportunity to create healthier lives, no matter your financial bracket, but at least those with more opportunity to give, we go in there, we do it a little differently, and then they're able to now support our organization through funding opportunities. But we also educate children in camps and aftercare programs, not just in corporations.
So it's really, you're hitting all the levels, because when you go into the schools, it's nearly impossible to get a hold of the parents. So you have the one-on-one with the children, and then you're able to get into that corporate level and really educate the adults as well.
Correct.
Quite genius, actually.
So for instance, we've actually worked with over 10,000 kids in the community, teaching them how to read nutrition labels, identify healthy and unhealthy fats, carbs, and proteins, create healthier associations between foods and feelings, and really just making children more nutritionally responsible. And even if they can't make their own decisions now, they will be able to soon. And you'll find that when you're making healthier foods familiar to them, they'll be more they'll be more likely to choose those healthy foods. But if you create a healthy spread, and this is the first time any of these children have ever seen any of these items, they're gonna stay away from it. But the second they become familiar and start understanding that the food and trying them and seeing that they taste good, that healthy spread will be gone. So that's part of our program.
Closing the gap on that knowledge really is power. You know, everyone that I interview usually has something that goes on in their life that leads to their bigger mission, vision. Why is it that you started Eat Better, Live Better?
Well, back in 2013, I lost 70 pounds, and I reversed my daughter's medical conditions with food. No doctors needed. And so I actually was working in dentistry for a while. Since I was 14, I had 2 jobs. And when I moved to Florida in 2012, I started working in a dental office, and that's where I did my transition. Well, during that transition, I lost 60 pounds in the process of like 6 or 7 months. And the patients would come from one appointment to the next, and they would say, "Where's the other girl who used to work here?" And I'm like, "No, it's me." And they were like, "No." And they'd all make this face. They're like, "Yeah, the other girl was." And I'm like, "No, that really was me." And so what happened is, by accident, I inspired a lot of those patients to get healthy. So I would get follow-up calls saying, I joined a gym, or I'm making, this for food or whatever. And I would host workout boot camps in the parking lot during my lunch break or after hours. And eventually I, got out of dentistry and just went into just health in general, whether it was exercise or nutrition or feeding people. And in 2016, I thought back, or I'm sorry, it was actually 2015, because I didn't just wake up January 1st in 2016 and start the organization. But I decided to think, how did I actually teach my daughter? And how did I teach myself? And I created a curriculum that is effective, evidence-based, and makes a difference. The kids learn, they enjoy it, and we even have now expanded to college, where, at the FAU, I host a workshop for the School of Social Work. Every semester, I work with, their kids, they're adults, and we
still kids, though. Still learning.
They're some of them my age. Hopefully future colleagues, hopefully future founders of nonprofits, or inventors of, a way to provide food to the community, or access to it.
You guys have been busy. You do a teacher's giving. Mm-hmm. I wanted to talk a little bit about how you go right into the school systems here in Palm Beach County.
Yeah.
And you really create this feeling of healthy living by being able to give back directly to the workers who give so much of their time and money. You and I spoke candidly about even the pay of teachers, and a lot of them having to dip into their own funds to supply for their classrooms. We all know this is true. I feel teachers are underpaid as well. And I'd like to hear a little bit more about that Thanksgiving type program that you created.
Well, it's not just the teachers that need the support. It's the teachers, it's the folks who keep the schools clean. It's the ones who cook for the kids in the cafeteria every day, and they make even less than the teachers.
That's right.
So we do something called Teachers Giving, where we surprise the teachers and support staff with turkeys. Thousands of pounds of turkeys.
Donated to your foundation.
We actually,
partnership.
Well, sort of. We buy most of the turkeys.
Yeah.
We would love to have them donated, but we buy them through community partners who actually give us funds and support this event, in allowing us to purchase these turkeys for the teachers and support staff. So we actually go into the schools, we coordinate with the principals in advance, and we find out how many staff they have. We get the turkeys, we show up, and the teachers are in their classrooms teaching, and then we just bust in the door with the turkey and 5 or 10 people with us, and we make the kids clap for the teachers and everything. We go into the cafeteria, round up all the cafeteria workers, and give turkeys to all the staff. It's just such a feel-good moment.
Yeah.
That it does a few things. It takes the financial thing off of the plate of the staff at the schools. We've had teachers cry because they didn't have enough money to buy their own turkeys. We've had teachers say that they had to give their last to one of their students, and we have teachers who even have second jobs just to be able to afford things for their kids that are struggling in these schools. So for us to be able to do this, especially with the rising costs, and not to mention, we feed teachers too. Teachers are paycheck to paycheck already, and then these rising costs of food and life has brought them to seek our services for actual food. So this is a way to help the teachers in a small financial investment in each teacher, while doubling up with appreciation, which they do get a lack of.
That is so true. Well, you and I were talking about what your future holds, and it's so intriguing to me because you are somebody that I feel as though creates that vibe. You begin that motion forward, and then it's so polarizing. You're pulling in these partnerships and this community for everyone to really want to have a healthy life in some way, whether they're learning or doing, volunteering, and you shared with me that you're currently in school.
Mm-hmm.
What is it that you're working on right now?
I am in school because I want to pursue a career in law with a focus on public interest and civil rights, and continue, obviously, eat better, live better, but I feel like I can advocate and do a lot more for the community with that degree behind me.
Yeah, I think your boots on the ground knowledge of what's working and what's not working at a federal and a state level is really going to give you, if you will, the street cred to be able to polarize those groups.
I got street cred.
You do?
I do.
Everyone that is involved with your foundation wants to be able to help you because what you're doing is making a difference. So I wanted to just speak with you a little bit about Mother's Day. Mother's Day is right around the corner. You just mentioned May 6th that you're going to be feeding about 2,000 families. Individuals, right? And so what does Mother's Day look like at Eat Better, Live Better?
Well, most of the families that we serve have a mom in it. So we are going to be doing something a little special because that's the Friday before Mother's Day, and we want to make sure that all the families that come in will have the opportunity to have a really nice meal on Mother's Day and cook and stay home and enjoy their family without worrying about any type of food insecurity at all. So we are going to do something a little above and beyond for Mother's Day, just like we do for Easter. We gave out Easter eggs. For Passover, we gave out matzah. We really just try to make sure that all of the families that we serve don't miss out on the joy and happiness that holidays bring.
Yeah, you know, it's really a message that you're bringing to the community. What is that message that you would like this community to hear from you so that they can become ignited to want to come in and help you with what you need?
Well, you have to do what's best for your own backyard. You live in the neighborhood, you live in the community. I feel it's your duty to, if you have the opportunity, to be a part of making that community a success. Whether, you're at a store and you just do something simple like open a door for someone who's got their hands full, or you come into an organization like Eat Better, Live Better, and roll up your sleeves and get to work and make sure that your community has food, or go to another organization and help with housing, or, there's so many different opportunities to serve that if you're capable of it, it's an invaluable feeling that you can't really describe. And get your kids involved, because kids have they're so empathetic, and if you teach them empathy and philanthropy and volunteerism from the time you're a young kid. We have 1 and 2 year olds volunteering with us because they can decorate the grocery bags that go out to the families we serve. So they're in our office, they're home, they're learning about volunteerism at 1 or 2 years old. So there's an opportunity for everyone to get involved as far as their time. There's an opportunity for, if you have the financial means, to make a financial monetary donation so we can keep serving and make sure we don't have to turn anyone away. And right now, that's probably one of the most crucial things that we're facing is we don't know how high these prices are going to go, and we don't know how many families this is going to hit. So we are trying to be prepared. We have a huge fundraising effort right now to make sure that every family who comes to us will make sure they go home with something to eat, and they won't have to worry about anything as far as food is related.
Well, Healthy Family Palm Beach Magazine is so excited to have you on our May cover, highlighting mothers, highlighting community, highlighting faith, coming together, working in partnership. You are a perfect example of how it is that when you set your sights on success, you can achieve those goals. Thank you so much for sitting down with us today. And to read more about this, please look to Healthy Families Palm Beach Magazine's edition with our cover, Debra Tendrich, CEO of Eat Better, Live Better. Thank you again, Debra, for joining us today.
Thank you. And if you're a family that is struggling right now financially and you are afraid to ask for help, This is a safe place for you to come and ask for help. Do not feel bad. Everyone at some point needs to ask for help, and we're going to be here for you.
We will have all of your lead backs as well as how to contact you directly so that nobody goes hungry here in Delray. Thank you again, Debra.
Thank you.